co-founder and director of the Stanford Center for Biodesign. Welcome to the FOMO series.
Thank you so much.
I had the pleasure of sitting down with you at a keynote at DeviceTalks West, and there we talked about some threats to the ecosystem. We talked about FDA, we talked about reimbursement, but I really wanted to focus on investment and the MedTech ecosystem, the innovation ecosystem. So first, what drew you into MedTech and venture capital? I know you started as you studied to be a physician.
Right.
Like, where did that pivot go to venture capital?
I think that the realization that venture capital drives innovation in this country is what brought me there. And it is, all these players are all intimately connected to one another. So to be able to understand, I think you're a better innovator if you understand what investors want. So that's probably what drew me in that direction, was that if I can get closer to the source of the power source, that I could actually understand it and utilize that information to help my own ventures, but also other people's.
I think I've heard it say that where the money flows, the attention goes.
That is true.
And so what a better way to get attention and awareness. But
exactly.
So let's talk about the biggest or most noteworthy challenges to the MedTech innovation ecosystem today.
Yeah. Well, the number one challenge is reimbursement. That is the issue that we really need to solve. I would say that innovations have heard the message that they need to be cost effective, that they need to be, thoughtful and really improve outcomes. They aren't just about technology for technology's sake. They're supposed to improve care and hopefully improve efficiencies, lower costs ultimately. So I think innovators have done that, but we are facing a lot of still headwinds with private insurers and also in the public system that need to be addressed. And we've got to solve it for every patient out there and to keep our innovation ecosystem healthy.
So we're talking about what we need to do based off those challenges. Have there been any technical achievements or policy achievements or anything that's getting us there today?
On the reimbursement side, you have to sort of look at the different verticals. I would say on the coding side, that's really the domain of AMA. We have made some, I think there have been some steps forward, but we have some work to do. I think the last remaining thing that we really need to work on is this thing called widespread use, which is a requirement for Cat 1 codes that we need to make transparent, predictable, and fair. I think if we do that, that will sort of solve some of the coding issues. The next part is coverage, and that's where we really still have many, many issues. The proliferation of prior authorization is a big threat for innovation. The fact that AI and sort of AI agents are being deployed to manage a lot of that is very scary, because it used to at least involve humans, I think less and less so. And that's making it exceptionally difficult for patients and physicians to advance new technologies and really get some degree of coverage. It's been a real roadblock, and it's costing everyone money, including the insurance companies. It's costing them money too. They think they're deploying it to save money, but it's not. It is costing everyone more money. So we have to fix it.
What does fixing it look like?
Fixing it looks like having a rational and transparent, predictable process. One that I would like to see almost leans into new technologies, allows for the medical directors to have direct contact with the innovators, direct contact with the physicians that are trying to advance the technology, and makes it a less arduous process. I mean, this process of prior authorization, rejection, appeal, and that whole thing, just wasting a lot of time. And many of these technologies deserve to be here. They are coming, and it's really just a test of who can last the longest. And that's really not benefiting our economy. And so I think we can do a better job of evaluating and creating the right frameworks for approval of these things based on clinical evidence, and advance the ball forward and get coverage for patients that need help, don't have a good solution. And when the new solution has the potential and has a reasonable amount of clinical evidence that should be covered.
Do you see the industry responding in actionable ways that might get us closer to where we need to go? Like, do you see anything happening right now that might be urging?
On the public side, there are several bills in Congress right now that look like they will move forward some form of accelerated coverage for breakthrough devices, which is great. It won't be as extensive as the original MCIT idea, the Medical Coverage for Innovative Technology proposal that was an executive order. That was put aside, but I think that the bills that have emerged are doable, inexpensive, and still will have a good impact. I think I would love to see more, but that's a good first step. So that's some movement. On the private side, I'm not seeing any movement right now. We have a lot of work to do.
What about venture capital specifically? How do you see it changing in the near future? And is that change for the better?
Yeah. Well, right now, venture capital has moved bigger funds later stage. A lot of the money is there. And that's benefiting groups or companies that have been able to advance their technology into late pivotal or early clinic commercialization or even mid-commercialization. There's money out there for those firms. The early stage and sort of early mid stage is really suffering right now, and that's where we need more investment. And that's where it would be nice to see some of the leading companies lean in to help support. This has happened in the past, and they did. In a previous significantly challenged period for medical devices around the time of 2008, 2010, big companies like J&J did lean in and invested much more heavily in the early stage ecosystem, and that was tremendously helpful. So I think this is a call to action for companies that care about, that basically are the recipients of this innovation, that buy this innovation, that use it for their growth. It's an opportunity for them to step forward. But I think we also need to fix some of the fundamentals of our ecosystem around reimbursement to shorten the timelines to liquidity, and that will help a lot too. So these two factors, I think, can be helpful right now.
And if both of those happen,
yeah,
and I'm going to take away when.
Right.
Let's be optimistic. When both of these happen,
Yeah.
how is that going to impact our ecosystem in the long-term future?
Well, I think we're going to, if those two things are addressed, I think we're going to see an increase in early stage investors, which means that novel new ideas are going to get more money and more opportunity to evaluate whether they work or not. And it's going to just keep the flywheel going. And as I mentioned when we just spoke, the Nobel Prize was just awarded to economists that identified innovation as one of the primary things that keeps economies healthy. So innovation in all these sectors is important, and medical technology and health couldn't be more important to everybody. So I'm hoping that we see alignment between that insight that the Nobel Committee decided on and the opportunity for everyone to participate in trying to make this better.
You and me both. Josh Makower,
Yeah.
thank you so much for
Thank
joining
you.
us on the future of MedTech opportunity.
Thanks so much. Yeah, real pleasure, Kayleen. Thank you.
Thank you.
Yeah.